Thank you, Mr. Chairman. Thanks to all of our witnesses. You know, where I come from, we always say that everything is bigger in Texas, and that often rings true with our excellent cancer research centers and treatment and our innovative medical research. But outrageously, it's also true because of Governor Greg Abbott's obstruction and support from his Republican enablers that we have the unfortunate distinction of more uninsured people, more uninsured children than any place in the country. This deplorable situation worsened over the last 2 years when Governor Abbott's administration denied over 2 million Texans who had been receiving coverage access to a family physician, often solely as a result of his administration's administrative errors. In my hometown of Austin, about half of all the children that are able to access care at the Children's Hospital, at Gell Children's Hospital, rely on Medicaid. About half of all the births in my hometown are covered by Medicaid. And nearly 300,000 mothers across the state are enrolled in Medicaid. For over 700,000 Texas seniors and individuals with disabilities who require long-term care and assistance and affording their medications, they get that through Medicaid. That's their lifeline. Even after all of the disastrous mistreatment and disinterest in those individuals with Medicaid in Texas, there are still 3 million children that are counting on it, a total of 4 million in all. I had one of those families contact me this morning, a mother concerned about her son Sam, who has Down syndrome and relies on Medicaid, is hoping to continue his educational opportunities but will require professional care. Mr. Dock, you referred to some of these challenges across the country, but what will be the effect of significant efforts to defund Medicaid in order to provide these giant tax breaks for Elon Musk and his buddies on people like Sam and his family? Could you speak into the microphone again?
First, I want to just thank you for all the leadership you've provided on the issue of health care throughout your time in Congress, and to note that I think I have over 25 members of my family in your district.
So I didn't know that, but I'm delighted to hear it.
Be represented by you. Now, unfortunately, the rest of this message is a little bit more dire. We are about to take away health care from 72 million Americans who need it the most. People who rely on it for preventative care, people who rely on it to give birth, people who rely on it to stay healthy and to see a doctor. They are all at risk, and for no reason except a desire to fund these tax breaks for the richest among us. It's important to think of these people as individuals. That's a big number, 72 million people, but if you think of them one family at a time, and you know the anxiety that they face when they're sick, when they can't afford to go to a doctor, when they know they need to, all the time incubating these diseases, in a sense, within their family, so that the only time they can go to a doctor is when they go to the emergency room. That tears people apart. I think we all know that healthcare is the kitchen table issue around America, because if you get sick, or your parents get sick, or your children get sick, that's all you ever think about. And compound that with knowing that you can't afford to go to a doctor. And think of the hell that everybody in that situation finds themselves. And now 72 million more Americans, a high percentage of them, will find themselves in that condition. And that's an outrage.
The University of Texas in Austin ranks number 14 in the entire world for interdisciplinary science. It's one of the top recipients of grants from the National Institutes for Health. There are many aspects there, but you mentioned your prior work with Ebola, where we had some success. I know there's another outbreak within the last few months in Uganda. What threats do you foresee for the University of Texas and for our families with these attacks on science and public health research?
Well, we should just start again with the numbers. So Texas will lose $300 million in NIH funding under this new proposal that came without any warning, without any planning, and makes no sense. $300 million less research being done in the state of Texas, which, as you said, is one of the leaders across the board, has some of the best medical schools and research institutions in the country. There is no way they can make that up. That means, a significant cut in research. I also want to say about my time one of my jobs in Ebola was to make sure it never came from West Africa to the United States. Let me tell you who helped us there. CDC and USAID. They traveled to those countries. They lived with sick patients, and they helped reduce the rate of Ebola in that country. When it came to, one of my jobs was to sleep with a buzzer underneath my pillow. So if somebody came in with a fever off an airplane from Africa, a CDC unit would go out and meet them and see if they caused a threat. And then we developed a vaccine, and who do you think helped us on that? NIH and WHO. So we are dismantling, through these cuts, the entire structure that kept America safe from Ebola in that outbreak in 2014.
Thank you very much for your testimony.
I now recognize Mr.